improving health equity through a program called Health Enterprise Zones. And at the same time, we were able to reduce binge drinking and reduce sexually transmitted illnesses. In addition, since the Affordable Care Act went into effect, we were able to help protect the gains that we made in Maryland, as well as build on them. So under the Affordable Care Act, the percent of Marylanders who were uninsured was cut in half, from about 12% to 6%, which is amazing. And we were able to not only protect it when it was under federal attack during the Trump administration, but we were actually able to build it and make it work even better in Maryland. So a few successes were Maryland created the first in the nation easy enrollment health insurance coverage program. And this is a program that allows uninsured Marylanders at tax time to check a box on their state income tax returns if they're uninsured and if they want to be connected with free or low-cost health coverage. The Easy Enrollment Program was expanded to add a checkbox to unemployment insurance forms as well, because if you've just lost your job, then probably applying for health coverage is a little bit behind, trying to make sure you still have enough money for rent or for food, and we wanted to make that as easy as possible. We also in Maryland were able to expand health coverage subsidies for young adults. That's a program that has been going for 2 years now, and because of that program, young adult Latinos had the greatest increase in health coverage among all of the racial and ethnic groups in the last 2 years in Maryland. So that's a big success. And this year, during the 2023 legislative session, we were able to extend that program for another 2 years. I want to talk a little bit about the Healthy Babies Equity Act, which was passed last year under CASA's amazing leadership of bringing people together to advocate for this important law. And starting this July, all Marylanders, regardless of their immigration status, who are pregnant, will be able to get access to Medicaid if they're income eligible for during their pregnancy and for a year postpartum. I also want to talk about some legislation that I'm really excited about this year, which is the SNAP program. And there's a law passed that will make it so that any Marylander who is enrolled in SNAP will be able to automatically get enrolled into Medicaid. So SNAP is the food assistance program, and it's for really low-income Marylanders. There are about 65,000 Marylanders who are enrolled in SNAP, but not enrolled in Medicaid. So this program is going to help those 65,000 Marylanders automatically get enrolled into Medicaid, which is health insurance for low-income adults. And it's also going to help people who need to renew their Medicaid status. An important thing to know is that the people who need to renew their Medicaid coverage are going to have to update their contact information this year and fill out some additional forms this year in order to keep their Medicaid coverage. And when this program starts, hopefully this summer, Marylanders who are enrolled in SNAP will just automatically be able to keep their Medicaid coverage instead of having to fill out that additional paperwork. And then once the enrollment for people who aren't yet enrolled in Medicaid yet, but will become automatically enrolled goes into effect, the vast majority of those 65,000 people are Black and Brown Marylanders. And so that's going to be a huge jump in improving health equity in our state. I talked a little bit about how when we expanded the alcohol tax, that we were able to put that money into what were called health enterprise zones. Because of that, years later, we were able to advocate for the Health Equity Resource Act, which is currently in effect and is investing $59 million to improve health outcomes and reduce disparities in Maryland. And we also were able to help pass the first in the nation Prescription Drug Affordability Board. So in order to do all that, we, as an organization, use 6 steps for effective advocacy. And we typically take on issues where there's a really important health policy that the public agrees is important to prioritize, but there are really well-financed interests that are opposed to it. And so in order to overcome powerful opposition, we use these 6 steps in order to move it forward. And so step 1 is to create an evidence-based plan. Look at the problem, talk with experts, talk with people on the ground, and figure out how do we resolve this issue. Step 2 is to commission a poll and see where the public sits on this issue. And this can be extremely powerful. When you commission a poll, you can check to see not only whether the public agrees with you on your issue, but whether it would actually influence the way that they would vote. If you can show that your issue has the support of the people and also can influence elections, that's going to be a really powerful issue and show you that you have a good shot of overcoming the opposition if you go through the rest of these steps. It can also help you to fine-tune your messaging in order to ensure that it resonates the best with the public and with elected officials as it can. The next step is to build a coalition. To build a coalition, you want it to be as big and as broad and as diverse as possible. So when we build coalitions, we try to include faith, business, labor, community, healthcare, school, any kinds of groups that exist. We try to include them in the coalition. And the way that we encourage them to sign on is we draft a 1-page resolution that explains what we're about, what we're trying to accomplish, and we ask for the organization to sign on. Now, this can take a while. To really build a big, robust coalition can take a couple of years, but it's worth it in order to overcome that opposition. The 4th step is to use the media as much as you can. You want to be hosting press conferences, writing op-eds, writing letters to the editor, using your social media, trying to get, if you can afford it, you can try to get paid ads, online ads, radio ads, paper ads. And then step 5 is to make your policy issue an election issue. So if you are able to take the same resolution that you used to build your coalition and adapt it for elected official candidates, then you can ask the candidates to endorse your resolution and tell them that after a certain date, you're going to publish who signed on to the resolution and who didn't. And that can be really powerful because then your issue has the attention of future legislators. And it also means that you have something from them so that when the legislative session comes, you already have a commitment from them to support your issue. And then finally, step 6, go win in the legislature. You want to bring your coalition to the legislature. You want to continue to engage the media and have press conferences, rallies, make sure that the hearings are well attended, make sure you have really great bill sponsors. And we have found that these 6 steps can be extremely effective, and they're how that we've been able to do all of the expansion of quality affordable health coverage that we have done in the past. So right now, we are currently building our coalition around our Healthcare for All resolution. I know the text is small, But you can see that the first part of the resolution says why Marylanders are not all enrolled in health coverage right now. Why is there still 6% who remain uninsured? And there are a few reasons. One of them is that many uninsured are undocumented and are ineligible for Medicaid and private insurance from Maryland Health Connection, despite contributing millions of dollars in taxes each year. Another reason is that there are a lot of Marylanders who are already eligible for free or very low-cost health coverage who just don't realize it or haven't applied for the program. And then third, there are folks who, even with the financial assistance already available, even if they're already eligible, still can't afford it. And so our resolution says that the organizations that are part of this coalition support automatically enrolling Marylanders who are eligible for free or low cost coverage into that coverage, adding more subsidy programs so that people can afford the coverage that they're eligible for, and removing immigration status as a barrier to health for Marylanders who would otherwise be eligible to enroll in Medicaid or private health plans for Maryland Health Connection. And so far we have, I think we're up to over 325 organizations have joined the coalition, including La Clínica del Pueblo and CASA. Thank you so much for your support. And we're working really hard to make these initiatives a reality. So I'm going to go back to the resolution. So some next steps for what we can do. I know that NINFA is going to talk about the Access to Care Act, which would have opened up private health coverage through Maryland Health Connection to all Marylanders, regardless of immigration status. I think that there are a few things from the 6 steps that we could take in order to make expanding access to undocumented immigrants a win in the future. And I think one of those things is that we're going to need some funding mechanism in order to pay for this health coverage. Now, we have precedent for this. Like I said, even before the Affordable Care Act, we were able to open up Medicaid for Marylanders because we increased the tobacco tax and we're able to raise funds that way. And so I think that there are a few different things that potentially we could consider. And I'm just going to go back to the 6 steps. So step 1, create an evidence-based plan. When we can talk about this during the breakout rooms, but one thing that we could consider is another alcohol tax. When we were fighting for the Health Equity Resource Act, we originally suggested doing another alcohol tax. And when we did polling on increasing the alcohol tax to pay for initiatives to help reduce health disparities in Maryland, we found that people liked that idea and that they would change their vote based on if their candidate supported that idea or not, which is very powerful. And so that was a different issue, but I think it's encouraging that there was support for an alcohol tax for a good health cause. So that's one possibility. Another possibility is there was legislation this year sponsored by Senator Kramer and Delegate Fraser Hidalgo that would penalize polluters for all of the damage that they have done to the environment. And it proposed that 20% of the funding from these penalties would go towards health coverage for uninsured Marylanders. And if that passed, that would raise $9 billion. So 20% of $9 billion, I guess that's $1.8 billion to expand access to health coverage, which would be plenty in order to get us from 6% to 0% uninsured. A potential other option is taxing sugar-sweetened beverages. So there are different ways that we could approach this problem in order to ensure that the funds are there to expand access to health coverage. All of them would come with heavy opposition from the industries that would be taxed or penalized in order to pay for that. And that's why with that heavy opposition, we really think that it's important to follow these 6 steps in order to overcome it. So those are a few ideas for how we can move forward, come up with a plan, do the polling, keep building our coalition. We encourage all organizations in Maryland to join our coalition by going to healthcareforall.com/resolution, and the organization can join that way. Keep making this a media issue and bring it up during election years, and then go win in the legislature. So that is our hope for the future. And I thank you for your time and happy to take any questions.
Thank you, Stephanie. Are you going to show that video?
I was going to, but I thought it wouldn't translate very well since it's just 2 minutes of nonstop talking. So I decided to just talk about it instead.
Okay, we will share the link after the event. Okay. Okay, thank you very much, Stephanie. It was a very interesting overview of coalition building that it helped us all to kind of have a structure for continuing to work for immigrants and immigrant access to healthcare. So now our second speaker is Ninfa Amador. She's a research and policy analyst at CASA. Welcome, Ninfa. Ninfa grew up in the DMV area and is a native of Honduras. Ninfa has first-hand experience of the challenges faced by undocumented community, as well as the life-changing effects of people-centered policy. Ninfa will speak about CASA's leadership in moving legislation forward to achieve healthcare for all immigrants in the state. Thank you, Ninfa. The mic is yours.
Good evening, everyone. Thank you, Lina and Suyana and everyone at the Clinica for hosting us here this evening. Suyana centered us extremely well about how we can continue moving forward with policies for the immigrant community in particular when it comes to healthcare access. So I'd like to share some background about CASA. For nearly 40 years, CASA has employed grassroots community organizing to bring our services to communities and to ensure that communities are closer together and are able to fight for justice, and helping to ensure that low-income immigrants are able to live rich and fulfilling lives. CASA is also the largest immigrant services and advocacy organization in Maryland in the Mid-Atlantic region, with a membership of over 120,000 Black and Latino immigrants and working families. Our mission is also to create a more just society by building power and improving the quality of life of working class and immigrant families. We envision a future where all of our members stand in their own power, where our immigrant and working class families live free from discrimination and fear, and where our diverse communities thrive as we work with our partners to achieve full human rights. So that's just a scope of what we at CASA do. And then at the last piece, we want to thank our partners like Stephanie at the Healthcare for All Coalition, at Clinica, for working with us to be able to provide this future that we envision for low-income, working class, and immigrant families in Maryland. As Lina said, my role is a policy and research analyst here at CASA. Within that role, I get to work with partners to see how we can best move forward policies for our communities, and in this space, particularly what we're talking about this evening, healthcare expansion to the immigrant undocumented community. I also, and I do this by working at the state level and working with our partners, legislators, anyone who is involved in this. That includes state agencies. So we connect our members, who are the ones that drive our work. We connect them and the policymakers, the stakeholders, to ensure that we're creating drafting and enacting these policies to benefit our community. So we are really community driven and member led. I would like to share that, CASA is part of the Healthcare for All Coalition. We also host an advocates call and have created an advocates table to discuss immigrant issues when it comes to healthcare. And we have been doing this for a number of years now. In 2021 or 2022, just last session, the Healthy Babies Equity Act passed. And this act will allow undocumented immigrant pregnant mothers to be able to access Medicaid. So, CASA has been working on many different ways to expand healthcare access. And my role is to lead this work at the state level. I would like to share, as mentioned, that there are many different levels that we work at, and in the counties as well. In Montgomery County, we have seen programs such as Montgomery Cares that allows any resident to enroll in their healthcare system and doesn't require immigration status. So our work and our community-driven efforts have paid off, and we are continuing this. And with that, I would like to turn back to the state level and our advocacy there. As I said, last year, we passed the Healthy Babies Equity Act. Last year, we also introduced the Access to Care Act, and this bill would have ensured anyone who lives in Maryland, anyone, regardless of immigration status, is able to buy health insurance through the individual marketplace that's subsidized by the Affordable Care Act. And this year, once again, healthcare is a priority for CASA members. That's why CASA is working heavily on healthcare. And this is a priority because many of our members are undocumented immigrants. Many of our members need healthcare, and they see that divide, and it affects them deeply, so much that we had 2 members this year who unfortunately passed away because of their inability to access care. I would like to uplift the name of Santos Romero, who was a very powerful advocate in the Baltimore area community for her community. And unfortunately, she passed away. She was diabetic, and towards the end of her life, she was lacking medicine and insulin, which is essential for anyone who's diabetic. So we really fight for our community, and we really see firsthand the effect that the current policies have. And therefore, we are fighting to make sure that we change the current policies so that we are more inclusive, more supportive, and more caring for our immigrant community in Maryland when it comes to healthcare. As a broader picture, Maryland is a state that does welcome immigrants, and we have seen many pro-immigrant policies that have been passed. And we want to continue this, and healthcare is the next step. So in 2023, CASA, alongside partners such as Healthcare for All, La Clinica, we all led an effort in support of the Access to Care Act. This bill passed in the House. It had support in the House, and unfortunately, it died in the Senate. So that just means that, we have to build up, as just Stephanie was saying, those steps of advocacy. We have to build up our advocacy greater in the Senate and build stronger relationships there. This session was very informative, though. The state policymakers, they know that this is an issue that impacts the immigrant community. We had many press conferences. I, in my role, connected our members with their legislators, their delegates and senators. So we have built the road for a stronger comeback as we seek to expand healthcare for everyone in Maryland. And I'll just also like to add that this legislative session was a very unique session. We have a new governor, so we do see, a way for immigrant priorities to be uplifted here in Maryland. Some wins that we also had this session, we introduced 2 healthcare related bills. One was a study that would look into data recording of the uninsured, especially the undocumented population. So we look forward to working with the Maryland Health Benefit Exchange to gather more specific and direct data about what are the options that the state has to expand Medicaid, the CHIP for children, and also the individual marketplace to undocumented immigrants. So those were some wins, and we are working with what we have. And as I said, some learning opportunities in the future are to how to create a stronger immigrant champions where we need them. So in the Senate, that will pass legislation that is pro-immigrant, that impacts the immigrant community. Lastly, I would like to share on moving forward, how will we do this? We're going to continue, as I said at the start, to bring members forward. We are member-led, so we ensure that the impacted individuals have a seat at the table. So we're going to continue to connect them with their legislators so that they can share and uplift their stories and their experiences and the dire need for healthcare for the uninsured. And in this reason, the uninsured, because of their immigration status, the undocumented and immigrant population. In the Access to Care Act this year, we needed to submit a waiver to allow the state to allow, we needed to submit a waiver to the federal government to allow the state to allow immigrants to, apply into the individual marketplace, the Affordable Care Act, and get those subsidies. We are moving our strategy forward and looking at ways to how to still do that, still submit that waiver, but without legislation, which is what, the session was for. We're looking at options to submit a waiver, either through executive order or any other avenue that's available to us, because we know that session is over. We have 9 months until another session begins next year. But our undocumented immigrant communities, they still need healthcare today. Many of our members need healthcare like yesterday, like many years ago. They need preventative care. So we're going to keep working to ensure that, even though we have that legislative advocacy avenue that's not open right now, that we can continue making steps forward in this fight. And we are also looking at other ways. The Access to Care Act was focused on the individual marketplace, the Affordable Care Act, but we're also looking at other ways to expand healthcare, as we're focused very much on uninsured populations, and the individual marketplace may not be affordable for some. So we want to ensure that we cover everyone, and that means looking also into Medicaid and how we can enroll more individuals into Medicaid. We have a great step forward with the Healthy Babies Equity Act. So we do have a blueprint about how to get immigrants covered, right? So we want to keep working on this and see how we can do this to make sure that we are ensuring our undocumented children who live in the state. And also, as Stephanie noted, the big if in all of these conversations is the money. So we want to ensure that we create a system where we have funding, and that we're not reliant on any extra funds that we may get, but we want to ensure that this is something that's sustainable for our community. And I look forward to discussing more about other avenues and strategies that we can take as we move forward in the breakout rooms. Thank you, Lena.
Ninfa, wow, that was a lot of excellent information and a summary of everything that we've worked on in this legislative process, and also last year with the Health Equity Baby Act that will enter into effect this summer, which is great news. So thank you, Ninfa, so much. Now I'm gonna introduce our third speaker. He is Trent Leon. He is a CASA's Maryland organizing director who couldn't be here in person, but he sent us a video with a message of why we need to continue prioritizing healthcare for immigrants. So if you bear with me, I'm gonna share the video.
Hi, Trent. Thank you so much. I know it will be difficult for you to join us live on Thursday. So we wanted to ask you today if you can give us your perspective. I know you were very active with CASA members. So first, if you can tell us a little bit of what you do with CASA, and then tell us what was the experience with this access to care advocacy actions. Hi, Trent. Thank you so much. I know it will be difficult for you to join us live on Thursday. So we wanted to ask you today if you can give us your perspective. I know you were very active with CASA members. So first, if you can tell us a little bit of what you do with CASA, and then tell us what was the experience with this access to care advocacy actions, and then if you can close with a message telling people how can we move forward, how can we continue this fight, and how can we overcome some of the obstacles that you had to experience during this legislative process.
Yes, so I can share that healthcare is the #1 priority for CASA members statewide in Maryland, whether that means because they have huge medical bills, or because they can't get care at a primary doctor, or because they can't pay for a prescription, or because when they go to the emergency room, they have to wait hours before they're seen. So there are so many reasons why healthcare is the #1 priority for CASA members. And this year in Annapolis, we made the small victory of getting a study to be able to, in the future, hopefully expand Medicaid. And we lost the access to care, which would have opened up the Affordable Care Act to allow people to purchase their own health insurance. We lost, even though it didn't add any subsidies for members to be able to purchase their own insurance plans. We are going to continue that fight, and we have to continue that fight. So many CASA members' lives depend on that, and that's why all of the CASA members are going to continue that fight. And we lost because we didn't have enough power to win. And so what do we have to do? We have to keep building power. The way that we can do that is by getting more members engaged in this fight for healthcare. And how do we do that? Maybe we have to do stronger actions. Maybe we have to call for a medical debt strike, where we tell everyone to not pay their medical debt. Maybe we have to target a hospital or an insurance company or a pharmaceutical company to make sure that they understand that they have to fight by our side to fight for access to care. So maybe we have to focus more locally on winning more local legislation that then we can win on the statewide level. There are so many ways, but we clearly need to build up more member strength, and we have to build more ally strength. And so the way that we do that is we obviously have to make those strategic decisions internally and as partners, but we have to keep fighting. You know, we knew this is going to be a multi-year fight, and we're not going to stop fighting until we get a victory. So the way I stay motivated is, you know, by talking to members who are going through the failures of our medical system every day. And the way that those members continue to fight is for their own needs and seeing their brothers and sisters going through that same suffering as a result of our broken medical systems. So I think I can leave that there. If there are any questions, I'm happy to talk further.
Thank you, Trent. I think this is more than enough. Thank you so much for all the fight. I know you put yourself out there. You motivate so many people. So thank you for doing this for the immigrant community. And we hope we can continue the dialogue next time in another event. And thank you for being a great partner. Take care. Bye.
Okay, so that concludes the first part of our event, and I now let Sujana explain the second part.
Wow, 3 great presentations, 3 great partners that we had this year and last year too. I think we're in this journey together for the last 2 years and has been incredible for us this. So the way that we like to do dialogues, we are going to invite all of you now to talk a little bit with us. Since we know talking the group like this, even though we're not a lot of people today, but I think we have enough people that discussing here in this group can be hard to manage. So here's the invitation. We believe that Stephanie, Nympha, and Trent inspired us to think about what happened so far, and also what even they believe can be done in the future. I think Stephanie has gave to us some ideas, Nympha too, and Trent too. But would like to see if together we could put some recommendations that it's pretty much recommendations for all of us, but also would inspire us, La Clinica, to keep moving in the next 9 months until the next legislative cycle. So we're going to divide ourselves in 2 groups. If you need being a group who is mainly speaks Spanish, I would need you to let us know now. It's just put on the chat the word Spanish, that we'll do that. If there is no need for that, we're going to have 2 groups. And of course, you can express yourself the way that you feel better. Are we ready to break into groups? We're going to create some recommendations. We like dialogues to end up with a list of recommendations. You have to choose someone on your group to represent the group and bring back, we're going to bring back here, it should be around like 20 minutes dialoguing together, and then select some recommendations and bring back here and show to everybody. Okay?
Okay, Sujana, thank you. I just divided into groups and we'll see if anyone needs the interpretation, we will work it out. Hola, Gladys. ¿Me escuchas?
To see where things are, and happy to help out in any way I can. Over.
Hi, I'm Brenda. I'm the donor relations officer at La Clinica, and I'm just happy to be here. I also have a background in advocacy and health advocacy in a former life, having been in the core of the campaign passing the ACA, and then also school-based health center policy over the years. So I'm excited to be here, not doing the policy work and being part of the conversation.
So actually we had people leaving the event, so I don't think we have, this is going to be us pretty much, right, Lina?
Yes, because the other room is like the interpreters, and Gladys, who didn't turn off her microphone, so maybe she left.
Yeah, we had also some people that, I think this is the part that some people don't wanted to join, right? I mean, we had through the event around 17 people, but this is, I think they were here more to learn than really have anything. So I don't know, can hear from Brenda and Jose Leandro if you two have anything that you'd like to add of what we're doing, or if you get something that we're missing, the point that we're missing, something that I think now is more recommending to La Clínica, right? This is would love to have, if you heard something today, and even you, Ninfa and Stephanie, if you think something that organization like La Clínica should keep doing, we would love to hear. And then we can take those recommendations to kind of inspire work for the next 9 months. The mic is open.
I have a question. I mean, and I mean, this is coming. So, you know, I work with our donors, and we have a number of donors who have policy expertise, like have been like health policy researchers. They've been chief of staff on the Hill with connections to, to still folks on the Hill and want to move Medicaid stuff. They have all these ideas about how they could potentially use their contacts and their knowledge to help move some of the policy in Maryland and whatnot. And of course, I can't get in the middle of that. And it's something we just don't have the capacity to facilitate some of that expertise. But knowing that you guys do, like you're at CASA and at the coalition, is there any way, do you guys need any of that kind of these are both basically mostly retired, not all of them, health policy folks, but, as we get ready for the next legislative session, especially, is there anything from the federal level that would be helpful if there was a tweak here or there in Medicaid, or if there was something that could help at the state level? And especially thinking about, so that's a big question out there, but I'll just pause. I'll say that, and then I'll let you respond before I ask 5 more questions.
Thank you, Brenda. So I think the question is there a space to connect current donors into this agenda with any of the 2 coalitions? Do you have any idea on how this could happen? There is any suggestion? I think it's less a recommendation, is more like now is a question for Ninfa and Stephanie, right?
Yeah, and what's to do if there ever, or
That's
just
okay.
let you guys know that we have this resource of folks that might be able to help out if ever needed in terms of connections and policy expertise. And if it would ever be needed, how would you want to communicate with us to connect you to that? I don't want to create, what I don't want is donors that are creating work for our partners, for us, just because they're interested in something, right? It's the last thing I want, right? You know what I mean? It's like, how do we, if it's something useful, great. If it's not, then I'll find something else for them to do,
I think on our end, not so much on needing the federal insider kind of connection, but if any of your donors are well connected with other organizations, national organizations or state or local organizations, they might be board members on other groups, depending on, their interests. We're always looking for groups to sign on to the resolution. And so, I mean, it can be any kind of group. It could be, if they attend a congregation or are part of a club, anything at all. If they could encourage those groups to sign on to the resolution, that would be a huge help, because when we go to the legislature, we bring that list, and the logo flyer I shared was just some of the over 300 groups, but we have an entire list that the bigger we can build it, the more power we have in Annapolis.
Okay.
I'll put the link in the chat.
Cool, that'd be awesome. Yeah, that actually might be something some of our donors could actually pretty easily do, actually, now that I'm thinking about it.
Thank
So
you
we
so
can
much
say
for
that okay, Nifa, go ahead.
I was gonna say thank you so much for connecting the dots there for us, Brenda, and for doing that. And yeah, at the federal level, if we could get the immigration eligibility, striked out from that, that would be great. Biden is trying to do that with the DACA population, but we're working here with fully undocumented immigrants. But one thing that politically, like the strategy that we're gonna pivot to now is how to ensure that we have a champion and Chair Griffith, who is the chair of the Finance Committee. And just overall, it's becoming more and more apparent that she just doesn't support this immigrant rights issue. And, it's just not her priority. And we are working to get her there. And if your donors live in District 25, have any connections to her, know who she listens to, things like that would be useful.
So what district, where is that? Where is District 25?
District 25 is like the district Capitol Heights area.
Oh, okay.
Yeah, it's like the up county in Prince George's County, I believe.
Okay.
So I think I just want to summarize 2 recommendations so far. I think one recommendation from this event that we have is to promote the Maryland Healthcare for All resolution among as many people as we know. We can do this individually, we can do this as a community, we can do with, like Brenda inspired us to ask this question. So I think one recommendation is we have something. Oh, welcome, Rick. I don't know, Nifa, Stephanie, if you know, Jose Leandro knows Rick already. Rick is our Chief Medical Officer, and he just joined the group. So I think one recommendation is that. I think the second recommendation that I hear here is how to impact Chair Griffin. So actually, Chair Griffin, she is from the healthcare field, and she really, we could not understand her position at all. But anyhow, feels like she needs a lot of education. But also, as we go around in Maryland and we see also people that we know in Maryland, would try to get her district to try to talk to her, right? I think we have something that we can do in the next 9 months is really educate her. I think one thing that make us very sad on her statement is like the uninsured don't need support in Maryland because Maryland has federal qualified health centers. So we felt like, don't do that to us. We're going to all be close our doors if you don't find a way to finance it, right? On a more complex way. So I think there's a lot of education to give to her because she was once a CFO at a federal qualified health center. So her perspective of federal qualified health center and the financing for the uninsured is really off, at least from the perspective of the immigrant. But also, we've been talking a lot about this, like we need a solution in a state as big as Maryland with some rural areas or some areas that are not close to places where there is federal qualified health centers that immigrants can access doctors where they are. Right, so it's much better if you finance a health insurance system that different doctors can accept than you only give money to the federal qualified health centers. That areas without federal qualified health center, the transportation become a huge barrier. So it's important for us to understand this here because it's important for us to keep pushing for something that in a state as large as Maryland. Right, with some, as I'm repeating myself, with areas that's not easy to find a doctor at all, even more federal qualified health centers. So we need, of course, more access. So we have 2 important recommendations, right, to keep promoting coalitions that exist and is already doing that. I think for me, it was very inspiring, Stephanie, the work that you all do. And I think a lot of organizations would like that keep analyzing other way to finance it, right? And for us, has been incredibly good to partner with CASA because we hear people without health insurance. We end up seeing a lot of people who has a doctor, right? At La Clinic, we end up being like equipment, who troubleshoot for some people. But with CASA, we heard the stories of people who does not have any medical home, right? Or don't know where to go. So has been, those two organizations has been very good for us. Also has been incredibly good for La Clínica have CASA organizing for it, right? We cannot do advocacy the way that CASA does. So the members are the community members, and we really was really good to hear from Trent or from you, Ninfa, that this is still an agenda for you all, right? That's not going to stop now. That's become really an agenda for CASA. And the other recommendation that I heard is how to impact on a federal level the immigrant agenda, right? The immigration agenda, not necessarily the healthcare agenda only, but the immigration agenda. So I think we have, and I like this recommendation because it's very comprehensive. So I'm going to stop summarizing here and see if Jose Leandro, you want to add anything that comes to you from your experience, from the point of view that you're seeing all this problem now?
Yeah, sure. Thank you. I think I was thinking bringing or having firsthand stories of people who have been affected by the lack of insurance, the disparate or low patient doctor ratio in communities. Like, how do you what are the best practices that this is for everyone? What are the best practices that y'all kind of employ and kind of get people motivated and inspired and also engaged, because advocacy can take, it's not, just a one election season or legislative season. It's long term, and keeping people engaged, on top of the fact that, the undocumented community, they experience other barriers, housing, transportation, employment, and then there's the issue about being undocumented. They're not always they're not coming from a background that's where they feel motivated or inspired to advocate for themselves. So I'm guessing, how do you take all of that and keep people who are affected by these issues engaged and able and feel confident in advocating?
Thank you. So yeah, I think this is a good recommendation too. We have to keep collecting stories, right? I think there is a lot of education to do on this, and I think we're in a privileged position to collect stories or having documentation of stories of people, the barriers for healthcare or barriers at the primary care level. We have a lot of stories of the struggle when we have to refer clients to secondary care, right? When we need a specialist, when we need an exam, when we need anything that we cannot troubleshoot in our area, in our center, this becomes dramatic in some situations. So I think keeping the stories, right, Jose Leandro, if I understood you. The other recommendation was recommendation question, how can we keep people motivated? We felt a lot of people really motivated, or at least activated during COVID, right? Basically, people were so scared that something was going to happen to them. So I don't know, Ninfa, if you've been talking about this, if you guys has had any discussion about how to keep your members activated. Now that feels like everybody's forgetting COVID, everybody's forgetting the pandemic. I don't know.
For us, it kind of depends on the campaign. So right now, yeah, vaccination campaign was a big one. And that did open up our health, the health department we have at CASA. We have 30 staff under the health department because of the grants and all the funding that, as you're saying, that that focus on health services during the pandemic. Right now, we're pivoting to the next thing, that's the Healthy Babies Equity Act, and getting information out about that. But in general, we host community fairs. We have promoters that are out in the community, letting them know of what's available to them. But I think that's once the emergency, next month, I forget when it is,
this month,
is over. I think that's something that we're gonna have to pivot to seeing now what is our strategy? So that is something we're still working on.
Okay, I think the recommendation could be us keep connected to find out that, right? How can we complement each other on keeping people motivated, or would be interesting to have maybe in some discussion moving forward, have a discussion between us or when we go to coalitions, right? Meetings to take that into consideration too. How keeping people motivated. Anything else? I feel we have enough to work on.
I just wanted to share, I put in the chat a brief about what other states have done to expand access. And, you know, some states have expanded Medicaid to undocumented immigrants. I think California has actually expanded it to all age groups, which is pretty impressive. And other states have been making progress too. A few have been making progress on the private health insurance plans with subsidies. And so I think it's always helpful to see what other people are doing when we're trying to look at how we can succeed in our own state if there are leaders elsewhere.
Mm-hmm. Are we good? Any more wisdom to share? I don't know how to thank you enough, Nympha, Stephanie, to join us today. I know that you're on a kind of trying to recuperate of all the work that you guys did. I would like to let you know that this recording is going to be promoted among our staff. So this would also impact trainings and things that we can do moving forward of La Clinica. And this can help to educate internally. And we're going to use that also to inspire our advocacy committee to design what's going to be some of the actions that we're going to have from now until next year. Thank you again for your time. Brenda, Jose Leandro, Rick, thanks so much for joining us. We have some people joining before. And Lina, again, would not be able to do this without you, dear.
Thank you, Sujana. Thank you, everybody. Thank you, Stephanie and Nympha especially for speaking today.
Thank you so much.
It's a pleasure to have a partner in you all, and yeah, let us know. We'll be in contact in the interim. See what we can do.
Nympha.
I think we're going to have to leave this room to leave the session, but it was a pleasure to be of you. Jose Leandro, keep in touch.
Bye.
Thank you.
Bye.